Good morning. Now I'll be discussing the topic about vital signs. And we all know that vital signs is very important for us, nursing assistant, because it will give us the basis to check for our patients if there is any abnormality, if there's any problems with our patients. So we can use the vital signs as a basis. That's why it's called vital signs, because it is vital, it is important. So let's take a look what are those things included in vital signs. So what is vital signs? Vital signs reflects the function of mainly the three body processes, which is the body temperature, breathing, and heart function. So body temperature, we are getting the temperature of the patient through axillary, tympanic, we have also temporal, we have also oral and rectal. Breathing, we are using the respiratory rate, okay, or RR. And lastly is the heart function, which includes your blood pressure, the oxygen saturation, and uh, pulse, pulse rate, and heart rate. So let's start with temperature. Temperature is an important aspect or an important part of vital signs because it is the amount of heat in the body. So any patient who whose body heat is increased, we can call them as febrile, or the patient with fever, or hyperthermia. So first, let's take a look what are those factors or points which affects the temperature. First is the stress. Stress, time of the day, environment, age, gender, exercise, and disease. Okay, let's talk about stress first. So stress, if any person who have stress, okay, what the body will do is it will increase your temperature. Time of the day, there are certain time in each day that your temperature is high, and there are time or hour in the day where your temperature is low. Usually the time of the day where temperature is low uh, is the is during 3 a.m. and 4 a.m. Okay, and during daytime, most of the time, your temperature is high. Environment. As I've told you before, that the environment greatly affects your temperature because your body will adapt the temperature of the environment. For example, when you go outside for 1 hour and it's with sunny weather, your body will adapt to the temperature of the environment. So when you take that temperature of that person, it will be increased. Even the person has no signs of any fever. So uh, age. Age is very important also as a factor because as the patient ages or as a person ages, what do you think? It will increase or it will decrease the temperature? It will increase the temperature. So most of the time, they are preventing the baby from hypothermia because they are easy to be hypothermic. While as a person ages, the temperature will be increased. Gender. Gender, who do you think has a higher temperature or lower temperature? The male or the female? Based from the study that uh, male patient will generate more temperature or high temperature than the female. Why? Because male patient or male individual will have or is having more activities than the female. Next is the exercise. Exercise also affects the temperature in what way? When you're doing exercise, when you're exerting effort, when you're doing an activity, okay, your body will generate heat that will cause the increase of temperature. Lastly is the disease. Okay, any patient who have disease as body defense or the body mechanism is to increase the temperature, especially for those diseases who mainly attacks our immune system. For example, if you are having coughs and cold or simply an infection like UTI, okay, your body system or your WBC or your immune system will tell your body to increase the temperature so it will kill the foreign body or the foreign invaders. So these are the factors affecting body temperature. So let's go with the basic temperature sites that we are seeing in the hospital. So first we have the oral site. Okay, oral site is preferred because it's easy, it's accessible. Okay, you just put the temperature in the mouth and you can take the you can have the temperature. Next is the rectal site. Do you know that the rectal site is the most accurate? It's the most accurate site for getting temperature. Why? It's because the rectal site is inside the body. So anything inside the body will be accurate. Why? Because the environment will not affect it, unlike oral, unlike the axillary. So it is the most accurate. But nowadays, they are not using or they are seldom using this route because it's uncomfortable. Next is tympanic membrane site. Tympanic membrane site is more accurate than oral and axillary. What do you mean by tympanic membrane? Your tympanic membrane is located in your ear. So when you're taking this temperature site, you'll just put the thermometer inside the ears. Okay, so this is your pinna. Okay, if your patient is more than 3 years old, you will pull the pinna up and backward, and then you will put the tympanic thermometer. Then, if your patient is 3 years old below, you just pull the pinna down and backwards to make an accurate or to get an accurate reading. Next, temporal artery site. Temporal artery site is also called as the uh, forehead site. Okay, this is accurate and non-invasive. What do you mean by non-invasive? You don't need to put it inside the body. Okay, temporal artery site, most of the time we are using the temporal area. So we'll just put next to the forehead and you can obtain the body temperature. You can use the forehead, you can use the temporal here, the temporal area, and you can use here behind the ears. Okay, there are three sides of the temporal artery side, but we will be using the forehead. Next is the axillary site. Axillary site is the accessible site. So, like oral site, it is accessible. It's easy to use because you can easily see it. So these are the temperature sites that we are using in the hospital. So we will do all of this in our demonstration and hands-on, except the rectal side. But I will demonstrate it to you by mannequin. So these are the normal values of the temperature per site. Okay, we have the oral, rectal, axillary, tympanic, and temporal. Okay, we have here the normal temperature for adults and normal temperature for pediatrics in Celsius. As we can see, we have different. We have different normal values for each site. So we will not tell that a patient is febrile if the site of the temperature we uh, we use is from the rectal. See, the normal temperature of your rectal is 37 to 38.1. So if we base it from our previous learning, that this is a sign of fever, but it's not, because 38.1 is normal for rectal temperature. Why? Because it's inside. It's hot inside, so it will generate a higher temperature. Okay, so please memorize all of these normal values because it's very important. And I will include it in your exam. So, what do we mean by hyperthermia or hyperpyrexia, fever, or hypothermia? As I've told you before, when we touched the medical abbreviation and medical terms, I told you that when we're talking about hyper, it means increase. When we're talking or high, when we're talking about hypo, we are talking about low. When we're talking about thermia, it means temperature. So when we combine hyperthermia or hyperpyrexia, pyrexia means temperature also. So when we combine these two, we can get an increased amount of temperature above the normal range. So it is an increased temperature. In short, hyperthermia or hyperpyrexia, or in layman's term, it's fever. Hypothermia, on the other hand, is a temperature below the normal range. So what is the normal range? This is the normal range. So you should memorize what is the normal so you will know what is abnormal. So it's very difficult to know what is abnormal if you don't even know what is the basic. So what are the devices we are using just to get the temperature of the patient? We are using the thermometers. Thermometers is the device used to measure temperature. Meter, which means measure, temperature, it means thermo. Okay, we have different kinds of thermometer we are using in the hospital. We have glass thermometer, standard electronic thermometer. We have tympanic membrane thermometer, temporal artery thermometer, digital thermometer, disposal oral thermometer, temperature sensitive tape, and we have the pacifier thermometer. Okay, can you believe that we have the pacifier thermometer? It's like a baby's pacifier which have a meter inside. So I will do the hands-on demo for getting temperature when we will be having our face-to-face class. Okay. Now, so we finished the uh, temperature. I hope all of you understood it. Next, I'll be tackling pulse. Pulse is the beat of the heart felt at an artery as a wave of blood passes through the artery. Okay? Pulse is the beat of your heart felt at an artery as a wave of blood passes through the artery. Okay? In our demonstration, we will be using or we will be getting the pulse rate and the heart rate. There is a difference between pulse rate and heart rate. Pulse rate, it is the number of pulsations that can be felt in a minute. Okay? Pulse rate is the number of pulsations that can be felt in a 1 minute, okay? In any pulse sites in our body. So later I will discuss where are our pulse sites. While heart rate is the pulsations which that can be felt in your heart. Most of the time in the apex of the heart in 1 minute. Okay? Pulse rhythm. Pulse rhythm, it is the pattern of pulsations and the pauses between them. Okay? Rhythm means it's slow, it is slow, it is fast. Pulse amplitude is the force or quality of pulse. It is bounding, it is weak, or it is strong. That is pulse amplitude. What is this dysrhythmia? Dysrhythmia, it is an irregular pulse rhythm, okay? That's why we are using uh, the one we are calling AED, if you're familiar with it, automated external defibrillator, because we want to return the normal pulse rhythm of the heart. That is the uh, to, the, uh, to eliminate the dysrhythmia. So, what are the normal values of pulse rate according to ages? So, please memorize this also. The adult is having, the unit is beats per minute. When I'm asking you to, uh, to write the normal values, you should include the unit, okay? Because we don't know what is that. Maybe it's respiratory rate, maybe it's pulse rate, so we don't know. So we should use, or we should write also the units. For adults, the normal pulse rate is 60 to 100 beats per minute, okay? Adolescent, 12 to 20 years, it should be 75 to 110 beats per minute. School age children is 5 to 12 years, 80 to 120 beats per minute. Preschooler, it is 80 to 130 beats per minute. And toddler, it is 120 to 160 beats per minute. So, I think, sorry, the infant is, please write it down, the infant, toddler, after toddler, infant is 120 to 160 beats per minute. As you will notice, as the person age decrease, the pulse rate will also increase. Okay, especially the baby or the infant, it will be the baby will be having an increased heart rate. Okay, which is normal to them, 120 to 160. Okay, this rhythmia, as I've told you, it's an irregular pulse rhythm. Tachycardia. Tachycardia, it is a rapid heart rate. Rapid means, tachy means rapid, and cardia means heart rate. So it means tachycardia means rapid heart rate or fast heart rate. So if your patient is an adult, the normal is 60 to 100. Okay? So if the patient is having 150 beats per minute, it will be considered as tachycardia. Okay? Because the normal is 60 to 100. So again, you should know the normal so you can know also the abnormal. Brady, on the other hand, is a slow Brady, which means slow. Heart rate is cardiac. So let's take a look what are those pulse sites that we are referring to. First pulse sites, please memorize all of these guys because it will be seen in your exam. Pulse sites. So we have two temporal pulse. Okay, if you notice, just palpate your the side of your forehead. This is where your temporal pulse is located. So you will feel that there are pulsations present. So this is temporal pulse. Next, you have the carotid pulse or the carotid pulse. Okay, how you will know that this is your carotid pulse? Okay, first is you locate your trachea. This is your trachea. Then you slide either right or left. Okay, you slide to the left or right. Okay, you will notice a groove. Okay, your carotid pulse is between the trachea and a muscle. Okay, it's located in a groove. Okay, you can feel that this is your carotid pulse. Carotid pulse is very important when you're doing BLS, okay? Especially to adult and child BLS. Because you will check the pulse not in the radial pulse, but you will check only to the carotid pulse. Okay, so you have two carotid pulse. Next, you have the apical pulse, okay? Your apical pulse is located on the left, not the right. It is located on the apex of the heart. So your heart is more on the left. So your apical pulse is located in the left part of the heart, okay? Later I will tell you where you will locate your apical pulse. Next is your brachial pulse. Brachial pulse. So your brachial pulse, okay, it's located in your arm. This is your arm. This is your forearm. Okay, so it's located in the medial aspect, middle of the arm. Okay, it's very important for to check on this during infant BLS. Next, you have the radial. Okay, this is the common site. Radial, this is the common site for checking pulse rate. Okay, if your patient is a normal patient, you will check the pulse rate via radial pulse. Okay, how you will know that it's a radial pulse? Your landmark is your thumb. Okay, this one, some students they are having they are confused where is the radial pulse is. Okay, your radial pulse is in line with your thumb. Okay, so this is the radial pulse. And the one in line with your little finger is your ulnar pulse. So most of the time we are using the radial pulse for normal patients. Next, femoral pulse. Femoral pulse is in your groin, okay? Femoral pulse is used for children BLS also if they can not appreciate the carotid pulse. Okay, it's in the groin. Next is popliteal. Popliteal is behind your knees. Okay, that's the popliteal area. We have also the posterior tibial pulse and we have the pedal pulse as well. Posterior tibial pulse and we have the pedal pulse or the dorsalis pedis pulse. So these are the pulse size that you should be familiar. Next, what are the factors affecting pulse? We have the medication, the disease, the exercise, age, gender, hormones, stress, and temperature. So medications. Medications can affect the pulse because if you're taking medications that can decrease pulse, okay, for example, if you're taking propanolol. Okay, all medications with lol, the ending, the end, the ending is lol. Okay, like propanolol or beta blockers. Oh, these are called beta blockers. These medications can cause the decreased pulse. Also, the digitalis or the digoxin, okay? It will decrease your pulse. So before giving this one to any patients, you should check first the pulse rate. Because if your patient pulse rate is, for example, adult patient, if your patient pulse rate is 50 and you gave this medication, it will decrease or it will drop the uh, pulse rate more. It will drop down the pulse rate more. Okay, so before giving any medication, you should know what is the side effects of the medication, what is this medication. So we should know what are the nursing considerations that we should do. Next is the disease. Okay, there are many diseases that can increase your pulse or that can increase or decrease your pulse. Okay, for example, if you're having fever, you will notice that the pulse will be increased. Okay, this is a defense mechanism of our body or any infections. Exercise. Okay, of course, if you're exerting an effort, exerting physical energy, your blood will be increased. Your blood or heart rate will be increased or your pulse rate will increase. Age, as I've told you before, that as the ages increase, it will decrease the heart rate, and as the ages decrease, it will increase the heart rate like the infant. Infant, the normal heart rate is 120 to 160 beats per minute. Okay, gender, who has a higher pulse rate, the male or the female? Of course, the male, because male is having more activities than female. Hormones, okay? If you are having a hormonal change, like you are having menstrual pain, if you are having hormonal changes like your uh, hormones for menstruation, you will notice that your sometimes you are having increased pulse rate. Okay, stress. Okay, it's given that if you are stressed, uh, your heart rate will be increased. Okay, because this is your defense mechanism. And temperature. As I've told you, if you have fever, high fever, your pulse will also be affected. That it will be increased. We have two ways in measuring your pulse. We have the radial pulse and we have the apical pulse. Okay, how we will know that uh, it is the radial pulse? As I've told you, your radial pulse is in line with your thumb. Okay, just use 2 to 3 fingers, palpate 2 to 3 fingers. Better 3, because if you are new, you cannot appreciate where is your radial pulse. So to make sure that you will appreciate it, make sure to use the 3 fingers. Okay, so how to use it? I'll show you a video later. So for normal person, you just count. That's why you need uh, a watch, okay, with a second hand clock, okay, to check for the radial pulse. Okay, for a normal person or normal patient, you should check for 30 seconds. Okay, for example, 30 seconds already, you got 30. Okay, then you multiply it by 2. So you will get 60. Okay, that is only for normal patients. But if your patient is with abnormal conditions like heart problem or any abnormal condition, you should check the radial pulse in full minute. Okay, in full minute. So no need to multiply it because it is measured in full minute. Only you will multiply it by 2 if you use 30 seconds or you measured it for 30 seconds only. So don't confuse yourself, guys. Okay. Next technique in measuring pulse is your apical pulse. Okay, your apical pulse can be measured or can be appreciated by using the auscultation of by stethoscope. Okay, you need your stethoscope to appreciate your apical pulse. Okay, where is your apical pulse located? Okay, as you can see in the picture, okay, it is located on the left side of the chest in the fifth intercostal space at the mid-clavicular line. Okay, so if you can see in the picture, this is your clavicle bone. Okay, okay. In the middle of this clavicle bone, okay, you will count the intercostal space. Okay, intercostal space means there is ribs that you will, in the space between the ribs, okay, 1, 2, 3, 4, 5, okay, this is your apical pulse located. So I will teach you how to do it. Okay, it's not easy if you are fat because it's very difficult to locate your bones. So let's see how we will do it. So next is we can use the apical radial pulse. So you will use it at the same time if the person is having a heart problem. Okay, so you will just compare what is the radial pulse that you have and what radial apical pulse that you got. So pulse deficit, it is the difference between the apical pulse and radial pulse rates. So for example, you got apical pulse of 100 and you got radial pulse of 80. So your pulse deficit is how much? 20. 100 minus 80. So stethoscope. Stethoscope, it is a vital device that can be used to check for apical pulse. Okay, make sounds louder and transfer it to the listener's ears is used to an apical pulse. Okay, to check for apical pulse, we are using the stethoscope. Okay, we have different parts of stethoscope. We have the ear pieces, we have a brace and binaurals, an amplifying device, and diaphragm and bell. Okay, so in the picture, take a look at the picture. This is the bell, the diaphragm we are using for the apical pulse. We have the tubing, the spring, and the binaural, and the ear tips. Okay, we should always clean the ear tips and the diaphragm and the bell before we are using it. Okay, because we don't know it is used already to other patients. So as prevention for infection, we should clean it with cotton swab or alcohol swab. Okay, so demonstration will be done in our face-to-face. Next, respiratory rate. Respiratory rate, it is the number of times the person breathes in 1 minute, or one breath is equal to both an inhalation and exhalation. How you will know that this is respiratory rate? Okay, you just observe the rise and fall of the chest, okay, without telling the patient that you are observing his or her breathing. Because if you told the patient that you're observing his respiratory rate, okay, he will be conscious and the what's this? The result will be inaccurate. Okay, so how you will count it? So if the chest will rise and fall, it's 1. Chest and rise and fall, it's 2. Rise and fall, 3. Okay, don't count this 1, 2, 3, 4. No. The normal cycle, rise, fall, 1, rise, fall, 2. It's like that. Okay, we have respiratory rhythm. It is the regularity with which the person breathes. Okay, if it's slow, it's fast. Depth of respiration, it is the quality of each breath. For example, if it is deep or shallow. Okay, shallow respiration, it's like the patient is having asthma. Okay, the patient wants to have more air. That's why his respiration is shallow. What is eupnea? EU means normal. Okay, so eupnea means normal respiratory rate. What is the normal respiratory rate for the adult and adolescent, school age child, years, preschooler, toddler, and infant? So for adult, the normal respiratory rate is 12 to 20 breaths per minute. Okay, don't be confused. In the pulse rate, it's beats per minute, while in respiratory rate, it is breaths per minute. Okay, adolescent 12 to 20 years, it's 15 to 20. School age 5 to 12 years old, 15 to 25. Preschooler is 20 to 34. Toddler is 30 to 60, and 24 to 40, and infant is 30 to 60. So you will notice as the patient age decrease, the respiratory rate will increase. As the person age will increase, the respiratory rate will decrease. It's vice versa. So what do you mean by tachypnea? Tachypnea, tachy, which means rapid or high. So it will be higher than the normal, greater than 24 breaths per minute in an adult. Bradypnea, respiratory rate that is lower than the normal, less than 10 breaths per minute. So if you don't know the normal, you will not know the abnormal. So memorize the normal. Hyperventilation. Hyperventilation means increased rate and depth of breathing. Okay, increased rate and depth of breathing is hyperventilation. Dyspnea, this which means difficulty, okay, or labored. So there will be labored or difficulty respirations are termed. So in the hospital, you will not hear the patient is having labored breathing. Okay, they will tell you the patient is having dyspnea. Okay, because it refers also to labored or difficult respirations. Next is hypoventilation. Hypoventilation, it is decreased rate and depth of breathing. Decreased rate and depth of breathing. Okay, demonstration will be done next Friday. Okay, this is very important. Blood pressure. Okay. Your blood pressure, it is the amount of force exerted against the walls of an artery by the blood, okay? You can see in the picture, okay, blood pressure, it is a force exerted by the walls of an artery or your blood vessels, okay? It is measured in mmHg or millimeters per mercury. Okay, what do you mean by systole and diastole? Systole is the period of heart muscle contraction. The heart is pumping blood. While diastole is a period of heart muscle relaxation. The heart is at rest. So, if your heart contracts, it will be systole. If your heart will relax, it will be diastole. So please memorize the normal values of blood pressure. We have the adult, the adolescents, school age, preschooler, toddler, and infant. Okay, so for adults, we have 100 to 140. This is the systolic. And the diastolic is 60 to 90. For adolescents, the systolic is 94 to 140, while the diastolic is 62 to 88, and so on and so on. What do you mean by hypotension and hypertension? When we're talking about hypotension, okay, hypo means low. So it means that the blood pressure is low to from its normal reading, okay? Usually for adult patient, the normal blood pressure is 120 over 80 millimeter per mercury, mmHg. Okay, for adult, the normal is 120 over 80 mmHg. So if your blood pressure is 80 over 60, we can consider it as hypotension. What is hypertension? Hypertension, it is a high blood pressure. So if your blood pressure is 160 over 120, the normal is 120 over 80, it will be considered as hypertension because it's high, 160 over 120. So what are the factors affecting blood pressure? We have the age, we have the gender, the blood volume, the stress, the pain, exercise, we have the weight, race, diet, drugs, position, smoking, and alcohol. Age. If the person age increase, the blood pressure will also increase. If you notice, those elderly patient is having a high blood pressure. Why? Because their arteries is not as good as when they are young. That's why the blood pressure is high. Gender. Male patient is having high blood pressure compared to female patient. Blood volume. Please take note of this. Your blood volume is equal to your blood pressure. Will always be equal to your blood pressure. So if you are having, what is blood volume? Your blood volume, it is the amount of blood which is circulated in your body. Okay. If your blood contains plasma, correct? Plasma is made up of water. So if the patient is having uh, dehydration, okay? Dehydration, the water is insufficient in the blood. So the blood volume will decrease. So if the blood volume will decrease, the blood pressure will follow. So the blood pressure will decrease as well. So always remember that blood volume is always equal to your blood pressure. Next is stress. If you are stressed, the blood pressure will be high. If you are relaxed, your blood pressure will be normal. Pain. The patient is having pain. You will notice in the vital signs that the one which is mainly affected is your blood pressure. So if your patient, if you got a high blood pressure, you ask your patient, do you feel pain? Okay, because most of the time, that's why blood pressure is high, it's because of pain. Exercise. Exercise, as you generate heat, as you generate energy, the blood pressure will be high. Weight. If you are overweight, your blood pressure will be high because your blood vessels will have more clots. So the blood will be having difficulty in going into the blood vessels. Okay? Compare if you are underweight or with normal weight. Race. Okay? Those African Americans or Caucasians, they are having more or having high blood pressure compared to other race. Diet. Diet is when you're taking more in salts, okay? Special salts, salty foods, okay? If you love salty foods, it will increase your blood pressure. Why? Because salt attracts water. And if you are attracting water, your blood volume will increase. So if your blood volume will increase, your blood pressure will increase. That's why for those patients who is hypertensive or with high blood pressure, the doctor will write low fat, low salt diet. Drugs. Okay, there are drugs which can increase your blood pressures and there are drugs which can decrease your blood pressure. For example, morphine. Okay, morphine is a narcotic painkiller. Okay, if you take the morphine, your blood pressure will drop. If you take cocaine, your blood pressure will be high. So any stimulants will increase your blood pressure. Any downers will decrease your blood pressure. Position. Okay. Your blood pressure also will depend on your position. If you're standing, if you're sitting, if you're lying. Smoking. If you're smoking, most of the time your blood pressure will be increased because of the nicotine contained in the cigarette. Okay, nicotine is a potent vasoconstrictor. What do you mean by that? Nicotine will affect your blood vessel to constrict or will constrict. So this is your blood vessel. This is where your blood will enter. So if you're taking cigarette, the nicotine contained in it will decrease the diameter of the blood vessel. So we'll constrict it and it will cause hypertension. Alcohol, okay, what alcohol will affect the blood pressure also because what it does, it is a downer. So what it does is it will decrease your blood pressure. Next, Korotkoff sounds. Okay, Korotkoff sounds, it's very vital in getting or appreciating the blood pressure readings. These are the sounds that we are hearing. Okay, it is a blood flow sounds that healthcare providers observe while taking blood pressure with a sphygmomanometer over the brachial artery in the antecubital fossa. Okay, we have 5 phases of Korotkoff sounds. We have the phase 1, faint but clear tapping sounds. Okay, so the first tapping sound or the phase 1, it is considered your systolic blood pressure. We have the phase 2, it is muffled or switching sounds. We have phase 3, distinct and loud tapping sounds. We have phase 4, the sound may abruptly become muffled and soft. And lastly, the phase 5, the last sound he heard before the period of continuous silence. And this is your diastolic pressure. Okay, so only the phase 1 and the phase 5 is important for blood pressure. So we have different types of blood pressure equipments. We have the aneroid type. This is what we'll be using. This is the aneroid type. And mind you, the aneroid type blood pressure machine is the most accurate blood pressure machine compared to the digital one. Because digital blood pressure machine is greatly affected by different gadgets in your home, like your mobile, your television, okay? The results will be affected. So the aneroid type is much accurate than those digital ones. We have the mercurial type. Actually, this is eliminated from the system because it caused a harmful effect in the patients. We have the electronic type or the digital type. We have the wrist type. So what are the guidelines in measuring blood pressure? First, do not take your BP on an arm with IV infusion. Okay, what will happen? There will be blood, blood flow in the IV set. Don't take your BP also with the arm with a cast. Okay, those patients who have fracture and with cast, don't take the BP because it will make the affected site swollen. With a dialysis access site, okay, if you notice those patients who have dialysis access site, okay, it is being operated, okay, just to make that access, and it costs a million, it costs a lot, okay, it will cost 100 dirhams, hundred thousands of dirhams just to create this site. So if you put the blood pressure cuff or you measure the blood pressure in this site, okay, it will ruin the access. Okay, so please don't use it as a blood pressure site. On the side of the breast surgery, if you are having surgery on the breast, for example, left, don't take the blood pressure on the left. What will happen? You will have a lymph edema. They're calling it as lymph edema. The site where you put the blood pressure, it will swell. Okay, so lymph edema, it's called lymph edema. So don't put it there. So put it on the opposite side, on an injured arm. If you have fracture, if you have weakness like left-sided weakness, don't put it on the left side, put it on the right side or the opposite side. Ask the nurse if you are not sure with arm to use, which arms to use. Okay, always. If you are not sure of anything, always use your in charge. Let the person rest for 10 to 20 minutes before measuring blood pressure. If your patient went for a walk or if your patient went to washroom, okay, don't immediately measure the blood pressure because it will generate a high readings. So please let the person rest for 10 to 20 minutes, then you measure the blood pressure. Next, measure BP with the person sitting or lying. You can measure the BP if a patient is sitting or lying, or the patient is standing. Okay, apply the cuff to the bare upper arm. Okay, clothing can affect measurement. So if you are folding the clothes, make sure that it's not so tight because it will affect the reading. Apply the cuff to, make sure the cuff is snug. It's not loose or it's not tight. Okay, so the reading will be wrong if the cuff is loose. Use a larger cuff if the person is obese and has a large arm. Don't use the normal blood pressure cuff to the person which is obese because it will not be accurate. Use a small cuff if the person is very small arm. Ask the nurse what size to use. Also check the care plan. So if your patient is a child, make sure that you use a cuff for a child. Make sure the room is quiet. Talking, TV, radio, and sounds from the hallway can affect an accurate measurement. This is applicable if you are using the digital blood pressure machine because any gadgets can affect the accurate measurement of the blood pressure. And if you are new, you should make sure that the room is quiet if you are using aneroid because if you are new, it's very difficult for you to appreciate the sounds. Place the diaphragm of the stethoscope firmly over the brachial artery. So where is your brachial artery? Brachial artery is located in the antecubital fossa. Okay, where's your antecubital fossa? It's located 2 to 3 fingers. You have the antecubital fossa here, the line in your arm, okay, 2 to 3 fingers above, that is your brachial fossa. Have the manometer where you can clearly see it, okay? The manometer, the reading, okay, where you can see it. Measure the systolic and the diastolic pressure. The diastolic pressures. The main point where the sound disappears is your diastolic pressure, okay? The point where the sound disappears is the diastolic pressure. Take the BP again if you are not sure of an accurate measurement. Wait for 30 to 60 seconds to repeat the measurement. So if you are in doubt of your measurement, just wait for 30 to 60 seconds to repeat the measurement. Because if you repeat it immediately, it will generate an inaccurate result. Tell the nurse at once if you cannot hear the blood pressure, okay? Because there are patients which has a weak pulse, so you cannot appreciate the blood pressure. So if you have doubt, if you cannot hear it, just tell it to the nurse because they are more expert in getting the blood pressure. Okay, first, before getting the blood pressure, we should estimate first the systolic pressure. Okay, well, how you will estimate the systolic pressure? Just inflate the cuff until you can no longer feel the pulse. And then you add 30. Okay, so I will discuss it. I will demonstrate it to you during our face-to-face class. Okay, what is estimated systolic pressure? This is the point where you will stop pumping uh, the bulb, okay? Because we cannot say, the patient told you my last BP is 160 over 80. So you will pump until over 160. What if your patient blood pressure already increased to 200 and you pump only to 160? So it will be inaccurate. So to make it accurate, to get it, the estimated systolic pressure accurately, we should do this process, okay? Inflate the cup until you can no longer feel the pulse. And then note this point and then you add 30. So for example, if you cannot hear the sound at 150, okay, you deflate it and then you add it 30. So I'll discuss all of this. Next is oxygen saturation. So oxygen saturation, I hope you understand the blood pressure, and you will fully understand it if we will do it during demonstration. Don't worry. Oxygen saturation, it is a fraction of oxygen saturated hemoglobin relatively the total hemoglobin in the blood. Okay, in short, it is the amount of oxygen in the blood. The normal oxygen saturation is 95 to 100%. Okay, 95 to 100%. The unit is percent. Okay, so the device used to check for oxygen saturation is pulse oximeter. Okay, pulse oximeter is very important for us nurses, okay, or for us nursing assistant, because we can uh, use the oxygen saturation not only for our patient but for ourselves. Okay, so if we have difficulty breathing, we can check for our oxygen saturation through pulse oximeter. It will greatly affect all of us, help all of us. So we have uh, we can measure two things in pulse oximeter. We can measure the oxygen saturation and we can also measure the pulse. So others, if they are lazy, they will not count manually the radial pulse. They just see the pulse oximeter and the pulse rate will be there also. What do the alarms of pulse oximeter tell you? First, low saturation, okay? Low saturation means it's below 90%. It is hypoxia, okay? It means that you have no or low oxygen in the blood. Next, it will alarm if there are no pulse detected. As I've told you, we have two things to measure in the pulse oximeter: pulse rate and oxygen saturation. If your pulse is low and if your pulse is high, okay, if your pulse is high, it will alarm also. Okay, what are the factors that can interfere the pulse oximeter reading? First is the light, okay, or bright light. If you use pulse oximeter in a bright light, okay, it will affect the reading. Shivering, too much bright light. Shivering, if your patient is shivering, there is repeat movement, it will generate an inaccurate result. Pulse volume, if your patient is having hypovolemic shock, okay, or arrhythmia, problems with the heart, okay, the oxygen saturation will be affected. Vasoconstriction. If your arms and foot is cold, okay, there will be vasoconstriction. That's why you will see that it will not be shown, the result will not be shown in the oximeter. So what you need to do is to put something to make the uh, arms and legs or hands and foot to be warm. Okay, you can put a blanket to make it warm. Okay, so make sure before putting it, make sure that it is warm. Carbon monoxide poisoning, it may give a false high saturation reading. So I'll demonstrate this. And before using oxygen saturation or pulse oximeter, please make sure that you don't have the patient is having no nail polish, okay, or any clear nail polish, because it will affect the result. Okay, that's why patients which is admitted in the hospital, okay, they will tell the relative to remove all the nail polish, okay, because to be easy to check for their oxygen saturation. Okay, next is the point of care testing or the capillary blood glucose test. Okay, point of care testing or the capillary blood glucose test. Rules for this is also called a CBG or capillary blood glucose, or we can uh, also use point of care testing or POCT. Okay, what are the rules when we are using a blood glucose testing? Follow the manufacturer's instructions for the glucometer and disinfectant. Different brands, different companies, okay, who sell glucometers kits, they have different rules or instructions, so you should follow it. Next, know how to use the equipment. Okay, it's not that easy. Sometimes uh, we have different techniques just to make sure that it is accurate. Okay, make sure the glucometer was tested for accuracy. Enter a code or user ID if you're required by glucometer. Make sure you have the correct reagent strips. Okay, don't put the other strips of other brands to your glucometer because be it will not work. Okay, scan the barcodes on the bottle of reagent strips if needed. Okay, it depends upon the type of the glucometer. Check the color of reagent strips. Check the expiration date of the strips. Okay, you cannot use the strips which is expired already. Report the result to the nurse at once. So if the result is abnormal, you should report it immediately. Okay, first is you recheck it. If it's still abnormal, you report it to the nurse in charge. And record the result following the agency policy. So this is point of care testing. It is a testing used for persons with diabetes. What is the normal point of care testing or capillary blood glucose test? The normal is 180 to 120 mg or milligram per deciliter. So please put the unit. What is the best time to test for CBG? 2 hours before or 2 hours after meal, because this is the time where your food is being absorbed by your body. So we'll demonstrate it later on. So thank you. This is the end of our vital signs discussion.